Probably there isn't a single person who hasn't had at least some small benign skin tumor. Papillomas, pigmented nevi, and various other formations generally accompany a person from the very moment of birth and throughout their entire life. Skin tumors are actually not always derived directly from the skin itself. They can originate from tissues that surround the skin, muscles that raise the hairs, sebaceous and sweat glands, subcutaneous fat, connective tissue, and so on. Skin tumors are broadly categorized into two main types, benign and malignant. While benign tumors generally cause us only some minor aesthetic concerns or cosmetic discomfort, malignant skin tumors can drastically and negatively impact a patient's overall quality of life. Furthermore, these serious conditions can affect their life expectancy, sometimes even leading to a fatal outcome. Malignant skin tumors, in turn, are also divided into pigmented skin tumors, which originate from pigmented tissue, colored tissue, and non-pigmented tumors, also known as non-melanoma skin cancers. A pigmented skin tumor usually refers to melanoma, while non-pigmented skin tumors are actually skin cancers themselves. Here we distinguish between basal cell carcinoma and squamous cell carcinoma of the skin. What symptoms do people most often present with when they suspect malignant skin tumors? It is appropriate to mention here that skin tumors can look very different from one another. Basal cell carcinoma is usually presented as a small flesh-colored nodule or a small ulcer with raised, rolled edges and a dry crust in the center, which can be easily removed, exposing a bleeding surface underneath. That's it. Squamous cell carcinoma appears as a flat ulcer without clear borders with an ulcerated and bleeding surface. Skin melanoma looks like a dark spot or a dark tumor, sometimes ulcerated, sometimes not, with indistinct edges. It usually begins with the appearance of some kind of new growth. Sometimes it bears such a striking resemblance to a benign growth that, in fact, very often the patient completely overlooks this initial phase and only begins to seek professional medical assistance at a much more advanced stage of the disease, which then requires far more complex and intensive additional treatment measures. But again, I repeat, at early stages it is very difficult to distinguish a benign tumor from a malignant one. How do skin tumors develop over time if they are not treated? Basal cell skin cancer, as a rule, has the most favorable course in this regard. The tumor usually does not metastasize and develops locally. It is classified as a locally destructive tumor. What does this mean? The tumor grows locally and destroys the tissues that are in the area of its development. The downside is that the tumor destroys the skin, muscle tissue, subcutaneous fat, and bones. Very often this can lead to quite disfiguring changes, especially when the tumor is located on the skin of the head. As for squamous cell carcinoma, it is a more aggressive tumor that is very often accompanied by the appearance of metastases in the lymph nodes or in distant organs. Most often, of course, the lymph nodes are affected and they look. If we examine the area of lymph nodes closest to the tumor, for example, in the upper limb, we are talking about the axillary region. In the lower limb, the inguinal lymph nodes. And if it is on the skin of the head, then the cervical lymph nodes. We can detect subcutaneous, spherical formations that, as the disease progresses, merge into large tumor conglomerates. If the process is left untreated, metastases may appear in distant organs. Most often the liver and lungs are affected, and sometimes the brain. The most aggressive in this regard is melanoma, a tumor that very often gives rise to metastases in lymph nodes and distant organs. Melanoma is characterized by very unique pathways of metastasis. Sometimes it produces metastases in the skin and soft tissues of the surrounding areas. These are called satellite or transit metastases. Moreover, it is typical for melanoma to have the primary tumor and metastases appear simultaneously. This occurs in about 10 to 15% of cases, and it immediately complicates the treatment process for such patients.